presentation. But before we start our presentation, let me introduce my team. Me, as your moderator, my name is Irvi Ramadhani, and my team is consists of Dwika Damara, and also Rafif Irfan, and also Nadia Rehani, and Reza Arya Putra, and also Farah Andani, and last is Mafira Herani. Well, before we start our presentation, let me introduce about tobacco. Well, I want to tell you some interesting fact about tobacco. As we know, tobacco is a plant. It's a same genus of nicotine. But do you know, a long time ago, tobacco is used for medicine. But nowadays, some people have added some harmful chemical materials to tobacco and make it into cigarettes. Well, actually, traditional cigarettes and modern cigarettes is totally different. Traditional cigarettes is better than modern cigarettes because traditional cigarette is only consist by tobacco, not like modern cigarettes. In modern cigarettes, there are so many of harmful chemical materials such as tar, floor cleaner, rocket fuel, car fuel, and even formalin. Can you believe that? Formalin in your cigarette. When you suck a cigarette, you already suck a formalin, car fuel, rocket fuel, and 1,000 of harmful chemical materials into your body. So that's why so many diseases could be happen to the smoker. Not only the active smoker, but the people around them. Or we could say it passive smoker. But now we want to present about the 6 diseases caused by the tobacco use.
My name is Dwika, and today I'm going to talk about ischemic heart disease. Ischemic heart disease, also known as coronary heart disease, is one of the most common heart disease. In fact, it has caused about 6,704,000 of death and 885,000 of death caused by tobacco in the world. And it is the leading cause of death in America. Ischemic heart disease is a narrowing of a blood vessel that supply blood and oxygen to your heart by plaque. If a person has this disease, they are most likely to suffer from heart attack. The cause of this disease is of course smoking and also diabetes, high blood cholesterol and high blood pressure. And if you have this disease, you will most likely to have the symptoms like you will feel heavy, like someone is squeezing your heart, and it is most likely that this will occur when you are doing activity or emotion. And also you will have short breath or fatigue. People recovers differently from ischemic heart disease. Some recovers by stop smoking, change their diet, and also by taking medication. But some people also need some surgery to recover from this disease. So that is all for me. Thank you.
Assalamualaikum everyone, my name is Nadia Rehani, and today I'm going to talk about cerebrovascular accident or CVA. Did you know that the patients of CVA are around 5 until 6 million people in the world, and there are 466,000 people died just because that CVA? Okay, CVA refers to a group of conditions that affect the circulation of the blood to the brain and causing limited or no blood flow to affected areas of the brain. And CVA primarily affects people that have a history of diabetes, smoking, or ischemic heart disease. And what are the causes of that CVA? The first is CVA occurs when a blood vessel that supplies a blood to a brain that is blocked by a blood clot. And the second is that CVA can also be caused by a blood clots that form in the heart. And the third is certain drugs and cigarettes can make your blood more likely to flow, and it can raise your risk for this CVA. But we can prevent that CVA by quitting smoking, eating heart healthy, a diet with low fat content, Then with avoiding obesity or avoiding anger and chronic stress. And thank you, that's all.
I'm Rafif and I will give you the information about the third killer disease caused by cigarettes. Lower respiratory tract infection, or well known as pneumonia, is inflammation of the lungs due to infection. The infection can be caused by bacteria, virus, fungi, or parasite. Smoking can affect the immune system because it often invites a respiratory tract infection. Along with the weakening of bronchs and lungs, impaired immunity is easier for bacteria and virus to survive and damage the tissue. Currently, over 3 million people suffer pneumonia each year in America, while most of the people recover, but approximately 5% will die because of pneumonia.
Hello,
Thank you.
my name is Reja, and I will tell you about chronic obstructive pulmonary disease or COPD. COPD is one of the most common lung disease. It makes it difficult to breathe. There are two main forms of COPD. The first, chronic bronchitis, which involves a long-term cold and mucus, and emphysema, which involves destruction of the lungs over time. Most people with COPD have a combination of both these conditions. Causes smoking is the leading cause of COPD. The more a person smokes, the more likely that person will develop COPD. Did you know? 1,000 more people died by COPD. But I will tell you the best thing for. But I will tell you that best test for COPD is a lung function test called spirometry. The result can be checked right away, and the test does not involve exercising, drawing blood, or exposure to radiation. Okay, that's all for me. Thank you.
Hello, my name is Farah Andani and I will explain about tuberculosis or TB. Tuberculosis is potentially a serious infection disease that mainly affect your lungs. The bacteria that cause tuberculosis are spread from one person to another through tiny droplets released into the air via cough and sneeze. There's a strong association between smoking tobacco and TB. Cigarette smoking can affect someone becomes infected with TB bacteria and how the infection progresses to active TB disease in three main ways. The first one, smoking harms the lungs and can make smokers more susceptible to TB infection. Second, smoking harms the body immune system, meaning smokers are less able to combat TB infection. And third, smoking reduces the effectiveness of TB treatment, which can lead to longer periods of infections or more severe form of the disease. According to WHO, in 2012, about 8.6 million people fell ill with TB and about 1.3 million people died from TB. Over 95% of TB deaths occur in low and middle income countries, and it's among the top 3 causes of death for women aged 15 to 44. And that's enough for me. And the next presentation will be explained by Mafira.
Hi guys, my name is Mafira Irani and I will tell you about lung, bronchus, and trachea cancer. Lung cancer, also known as carcinoma of the lung, is malignant lung tumor characterized by uncontrolled cell growth in the tissue of the lung. The most common cause is long-term tobacco smoke, which causes 80 until 90% lung cancer. Non-smokers account for 10 until 15% lung cancer cases. The most common treatment that highly suggested in this case are surgery, chemotherapy, and radiotherapy. Overall, 15% people in the US diagnosed with lung cancer survive 5 years after the diagnosis. In 2005, there is 1,290,000 people killed by this disease and 532,000 killed caused by tobacco smoke and 338,000 caused by other factors like genetic factor or air pollutant, radon gas, and many other factors. Well, the difference between lung, bronchus, and trachea cancer is the location of the cancer. Okay, that is all from me.
Well guys, we've already watched the video and also listened to my friend presentation. Now, I just want to give you the conclusion. So, the conclusion is, being a smoker, there are so many risks and also so many diseases could be happen to yourself. It's not about your lungs, but it could be your heart and your brain. So that's why I highly recommend you to don't ever try to become a smoker, because once you try to become smoker, you will be addicted. And then it not impact yourself, but it also impact the people around you, the people you love. So I just want to say this to you. If you are a smoker, then be ready to feel all of these diseases or even end of the death. Well, thank you guys to watching for our video. And for the question, you can ask us below the comment. Okay, thank you everyone. Goodbye.